Hello, welcome back to Pharma Training Solution, a channel which has been started to just deliver pharmaceutical information to the students who are currently at home. Now, that will be discussing quantification and procurement of drugs, of course, and also health supplies. Put that. Quantification, this is a process that involves estimating the amount of medicines or medical health supplies needed for procurement. Of course, quantification it is the component of procurement, and of course it ensures continuous availability of medicines and other health supplies, avoiding stockouts, overstocking, and ensures the use of scarce resources. Now, of course, you should come up with reasons for why what are the consequences of poor quantification, because if you quantify drugs poorly, what will happen? Of course, it will be a reverse of this. What are the methods of quantification? We have morbidity method, consumption method, adjusted consumption method, and service level projection for budget requirements. This one, service level for budget requirements, of course, it measures the bed days and the treatment. The bed days and the treatment, or how many patients you are receiving on outpatient, and how much can you use to manage each patient. Mostly used in budgeting only. Consumption technique, of course, this method uses historical data on consumption in the past to calculate the quantities that will be needed in the foreseeable future. Yeah. We have total consumption. Of course, we know. Usually we use 3 months. Total consumption, 3 months. How much drug has been consumed in the last 3 months? Just calculate for 3 months. However, you can use any period. But the common one is 3 months. Average monthly consumption, of course, AMC measure of how much has been used per month. Total divided by 3. Now, maximum stock is, of course, some drugs it is 5 months for essentials. But what about for health supplies? Usually 3 months, and for ARVs they recommend, I think, 2 months. Then minimum stock, it is AMC times 2, usually the 2 months. Now, sometimes we have out of stock. Of course, then we go to adjusted average monthly consumption. Of course, this adjustment enables to cater for days out of stock. How do we calculate it? I have 3 formulas. Adjusted AMC equals total consumption, or total number of days in a month, minus the days out of stock. Or days in a month. You can use days in months of consumption. In those months, 3 months, use the days in 3 months. Now, or you can calculate it based on total consumption divided by months of review, usually 3, and months when out of stock. Now, month out of stock is calculated as number of days over 30.5, and 30.5 is to indicate the month. Now, there are very many calculations which I have not discussed, but I'm sure you can follow up, or you can contact us in case you don't have them, but I'm sure you can get these calculations in your notes. Safety stock, of course, this is the amount of stock that is kept in reserve to cater for unexpected changes in consumption or demand of an item. Let's go to morbidity method. Now, this method uses morbidity data, of course, the disease burden, to find the number of people suffering from a condition. Then, using treatment guidelines, you look for the quantities of each drug used to manage each condition. Even though there are 5 drugs, you list them. You you multiply the dose per patient, and then the projected number of patients in the specific period, and then you come up with the consumption, with the quantity. However, it requires a lot of time and is rebellious. This pattern may change. Most of them are the consumption may change. Even the other side, consumption requires records. Prescribers may not follow the guidelines. They may just use anything else, any other drugs. Now, with adjusted monthly consumption, adjusted consumption method, because this one uses it is used when you are starting up a facility, when you don't have either when you don't have either consumption data or morbidity data. So which means that you get consumption data from another facility. After that, you extrapolate based on your population. Procurement of drugs, such as, of course, this is the process of acquiring medicines or supply from different suppliers or manufacturers to your facility. Yes. However, sometimes it is through donation. Even donation can be required as, can be termed as procurement. Now, documents which are in procurement have requisitions, purchase orders, order status report, delivery reports, invoices, receipts, packing lists, all these. Now, the fact, of course, the procurement cycle. Sure, you know the procurement cycle. Briefly explained it here. We have collection of consumption data, review of selection, determine quantities needed, reconcile the quantities, choose a procurement method, locate the suppliers, specify contract terms, monitor order status, receive, make payment, update record, distribute, and of course the cycle repeat. Now, however, in case you have already a supplier, most of these ones, you don't need to go through them again. This one is for those people who are just starting. Which are those methods of procurement? We have open tendering, restricted tendering, competitive negotiation, single source tendering, direct procurement, and request for proposal. I hope you can answer all these and you can explain them in details, because this is a short presentation. So this has been a short presentation, as I've said. These are other presentations which we have in pharmacy practice. You can always refer to them. You can contact us in the email which follow. I always remain Wilson from Pharma Training Solution. This is our WhatsApp number, email. Give us a thumbs up, or you can show us on how we can improve. And thank you very much.